MMT Cervical flexion, sternocleidomastoid, longus coli, scalene anterior. Assist the patient to the supine position with the head on the table. The arms are at the side. Stand next to the patient's head. Passively take the neck through cervical flexion by supporting the patient's head at the forehead with one hand and at the occiput with the other hand. You are not assessing the infield. You are determining how much range the patient is able to move in this direction so that you can appropriately assign a muscle grade. In patient-appropriate language, ask the patient to perform cervical flexion. Stabilize the patient across the chest if necessary. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. Common substitutions include trunk flexion that brings the shoulders off the mat and deviation into cervical rotation. The patient may also attempt to only perform capital flexion. After correcting any substitutions, ask the patient to perform the motion as previously. Stabilize the patient across the chest if necessary. With one hand, apply 2-finger resistance to the forehead. The other hand should be placed under the occiput to catch the head in case it gives way with the resistance. If stabilization is also necessary, you may need the help of a third person. The resistance is applied in a downward direction. Apply the force for a 5-second count. Grade 5, normal. The patient completes full range of motion in cervical flexion and holds against moderate 2-finger resistance. Grade 4, good. The patient completes full range of motion in cervical flexion but breaks against mild 2-finger resistance. Grade 3, fair. The patient completes full range of motion in cervical flexion but does not tolerate any resistance. There is no position change for grades 2 through 0. Stand at the head of the table facing the patient. Passively move the patient through cervical rotation to both sides to assess available motion. Position the patient's head in full rotation to one side, instructing the patient to rotate the head fully to the opposite side. Repeat the test in the other direction. Grade 2, poor. The patient completes full range of motion of cervical rotation to both sides. For grade 1, you must now palpate both sternocleidomastoids by placing your fingers over the muscles near the insertion at the mastoid process. Again, position the patient in full rotation to one side and instruct the patient to attempt to rotate the head to the opposite side. Recall that the right sternocleidomastoid rotates the head to the left side and that the left sternocleidomastoid rotates the head to the right side. Grade 1, trace. Partial range of motion to either side or palpable contractile activity. Grade 0, no palpable contraction.